Hey guys, what's up? Christina here, and I am here at Scheinblum Medical in Melville, going for now my second vampire facial, or PRP facial as some of you may know it. So make sure you tune in and you join me for this journey from start all the way to finish. Let's get started.
It's benzocaine, lidocaine, and tetracaine. So it's 3 different types of anesthetic that numb your face really good. So you're not gonna, basically not even feel this whole procedure.
She still looks gorgeous.
Starting, let me get everything ready so I can draw your blood.
All right,
This is
game on.
an essential part of the procedure. Come on, muscles, we'll get it done. Let's do it. This time, and we have some major veins going on here. So this one, if I miss this vein, guys, I seriously have to go into retirement. That means I'm way over the hill. So here we go. This is just going to be a traditional blood draw, nothing fancy about this, but we need blood in order to get this done because we have to take the blood and spin it down and get it into the form where it's just all platelets and growth factors, and that's what's going to make that collagen pop. So,
It's funny, I'm covered in tattoos, but I hate getting my blood drawn.
tube.
You want a squeeze ball?
Yeah. All right, so like I said, we just have a test tube right here. What I'm going to do is just a little tiny pain. Ooh, that's probably the worst pain you're going to have for the whole time. So now, like I said,
So it begins.
So it begins. So we have an awesome blood flow. This happens to be an FDA-approved device here that we use to separate the PRP. Every physician should absolutely use an FDA-approved device. You can't put this into just a regular test tube because there's components of this that make it sterile, that make it healthy, and that help us to separate the PRP, the liquid gold as we like to call it, from the parts of the blood that we don't need. And we're pretty much at the finish line here. We got all the
How
blood.
are you feeling?
No, I'm
Yeah,
Like a rock
yeah, I'm
star.
saying you guys are gonna have a good time as we make your collagen do its thing. So now what I'm doing is I'm taking the blood over to my centrifuge. Now there's a little anticoagulant in here, so I'm just gonna mix this up just so it doesn't start clotting. We don't want the platelets to clot before they get into your skin and start doing their thing. There happens to be a gel on the bottom. Like I was saying, this is an FDA-approved Eclipse, which I think is the most fantastic system to isolate the PRP. So the next step is I open this up. I have a balanced test tube in here. I'm just putting that blood in there. I'm gonna lock it all up and I'm gonna get it started. We have 10 minutes that this is gonna spin. This is gonna spin at 3,500 rotations per minute. By the time this is done in 10 minutes, that blood's gonna look a lot different. It's gonna be ready to do what it's supposed to do, which is make these beautiful ladies even more beautiful. So we'll see you back in 10 minutes when this is ready to go. And I don't know if all doctors, as a matter of fact, I know some places don't do this, but we're very cautious with the blood. So if that's something that you're concerned about or worried about, which you should be. Obviously, there are a lot of bloodborne types of diseases, and you don't want your blood to be mistaken for someone else's blood. So your blood will never leave your site the entire time we do the procedure. Basically, Christina's hanging out right here. The centrifuge is right there. Her blood's going to be in her sites the entire time. So this way, when it's time to inject the blood, you know 100% you're not going to have a single iota in the back of your mind saying, "Oh my goodness, I just had blood injected into me, and was it mine? It left the room. They had somebody process it." Not the case here. We are ultra cautious, ultra safe, and that's how we kind of do everything around here. I'm going to take the pen. This is called the skin pen. I'm not advertising. I'm not associated with this particular company. However, this is an FDA-approved device. That's why I use this particular device. What I need to do with this, because this is what's going to actually vibrate at an unbelievably high rate and make thousands, tens of thousands, even hundreds of thousands of little tiny openings in the skin that's going to allow me to inject the PRP, the platelets and the growth factors, into your skin. So the first step is I'm applying this little cover. What this does is it makes it so absolutely no blood. Once again, this is a completely safe procedure because we're not transferring any blood and there's no blood touching any of our equipment. So what I'm doing first of all is I'm just going to seal the device so this way no blood and no blood product can actually get onto the device here. There we go. So this is all sealed up beautifully here. And now get rid of this portion. And now the next step is I'm going to actually apply the needle. Cover on here, I'm actually going to apply this needle. This needle has, I don't know the exact amount, but it has probably somewhere in the range of about 16 separate tiny little needles. I mean, these are so microscopic, and those are the needles that can actually pierce the skin and allow us to put the PRP in. So right now, I just applied the cover. We use a brand new one every single time. There's actually a device in here that as soon as I apply this, it snaps. So if I take this off, I can never reuse it. Once again, totally safe. Now there are also little calibrations on this that allow me to choose different depths for different parts of the face, depending on how thick the collagen is in those areas. As we're doing the procedure, I'm gonna walk you through as I make my adjustments. All right, so the 10 minutes is up. That's my signal that the PRP is ready for me. So now what I'm gonna do is that I'm gonna unlock the centrifuge and I'm gonna remove the blood. Now you all remember what it looked like when I put it into the centrifuge, and look how fantastic. Can you believe that this is what the blood looks like now? This is the red blood cells. We do not want to use these. This actually can cause some inflammation, so these are isolated. This is the gel that I pointed out before that was down below. It's half the weight between the PRP, this beautiful liquid gold as I like to call it, which is plasma, platelets, and growth factors. And it separates it, so look how pure and clean. That's why I love this particular brand, because it's as clear as it can get. There's no red blood cells in there. This is all plasma, and the platelets love to hang out down low here. So what I'm gonna do is I'm just gonna invert the tube. What I'm trying to do is get any little platelets that are a little heavier down here. I just want to get them circulating, so this way we can get a nice high concentration of PRP. All right, so now it's ready to go. So now what I'm going to do is I draw it up into individual little syringes, and this is what we're going to actually use to drip on to Christina's face as we're making these little micropunctures and actually inject this PRP into her skin. We got a nice beautiful blood draw, lots of PRP into these, like I said, these little individual.
Produce the same amount of PRP, or is that, you know what I'm saying? Like,
yeah, that's a good question. In essence, yes. I mean, everybody has platelets, everybody has plasma. There are some small variations, but for the most part, by drawing a lot of blood, you're gonna get a sufficient amount of PRP, and this is an excellent amount we got here. I certainly don't skimp on the size of my test tube, just so we can get a wonderful amount of PRP. And this allows me to not only treat the face, but I could also do the neck, the décolleté. We can really cover a lot of ground with the amount of PRP that I drew up today.
The knees. People like, right?
the knees.
Yeah. That's
Taking off the anesthetic. Now her skin is going to be nice and numb. Just reduce any type of discomfort that these little tiny needles, may produce. Start on this cheek right here. So what we're going to do is we're just going to take the syringe filled with PRP, and you can gently put it on her cheek. And what I do now is I just kind of massage it around so it's kind of ready to be kind of injected. And then what I'm going to do is I'm going to go horizontally, and I'm literally, those little tiny needles are going up and down, and they're causing a little redness. If you can kind of see on close up, it almost looks like a mild sunburn. And what we're looking for is to just get little dot bleeding. Now I'm just rubbing in some more of the PRP. Okay, I'm gonna have you apply some more here. And actually, she has such beautiful collagen in her cheeks. She has such full cheeks that I'm actually going a little bit deeper. I want to see a little bit more of a response than that. So, once again, you may feel like a little bit of a bristly feeling as I'm doing this, but there's so much collagen here that we literally have to go a little deeper, and I'm going in horizontal fashion. See, we have a little bit of spot bleeding, and that's all we want. We don't want too much bleeding, because that'll cause inflammation. Now we're going to work on the forehead. And some of you who may not be familiar with PRP, how it originated, it's really not a new science. This is something that's been used in orthopedics and in dentistry for 25 some odd years to actually help to regrow tendons and ligaments and improve sports injuries. In dentistry, to grow back bone and gums and other tissue in that area. Basically, the PRP stimulates the stem cells in the areas that it's injected to regrow the tissue that is ordinarily there. Just like we mentioned, a lot of personalities, a lot of famous people use the vampire facial to perfect their skin. A lot of athletes, as a matter of fact, there's too many for me to even kind of recall, but I know Tiger Woods had PRP done on his back, Kobe Bryant had it done on his knees, Aroldis Chapman of the Yankees had it done last year, Jose Reyes from the Mets. Just a litany of people, famous people in the sports field have used this to speed up healing process. So that's why this technology has been out there. It's just more recently been applied to cosmetics.
So what's the downtime with this procedure?
I'd like to say there's no downtime. Like I was mentioning earlier, if you're a little self-conscious about having a little redness to your skin, you may want to do this on a Friday and go back to work on a Monday. But for all intents and purposes, you want to go out to dinner tonight. Nobody's gonna, if it's done correctly, nobody's gonna say, oh my goodness, what happened here? So like I said, it's more of a self-conscious thing. But in terms of having to do any additional treatments or kind of regulate your activities, I would say don't overly exercise. You don't want to, sweat too much. Or
Christina.
The poor baby. Yeah, she's gonna have to take 10 minutes off today. But
Now, what about after the treatment? What are you putting on your skin? Are you washing your skin tonight? What's happening?
Yeah, basically you're gonna feel a sense of dryness just because we've done this treatment. You're gonna get some micro, scabs on your skin. The trick is just to keep your skin very hydrated. You're gonna feel a little dryness.
No, we're actually going to
We
get
provide you with it, but we have a couple of different brands and one from SkinCeuticals that we recommend just to keep you feeling good, just to keep it nice and lubricated and nice and moist. But that's really it for the first day or two.
Oh, the first day.
For the first day or two, yes. This is what we suggest. There are other options too if you prefer, but this happens to work beautifully here. And we're just gonna
And
do
then
this
what
slowly.
happens if you're a person that uses, Retin-A or something like that? Would you hold off on that?
What I would do is for the first couple of days, we suggest just to use some of the lubricants, and after that we have a regimen where we put you on different types of you can get back into your Retin-A's and different types of glycolics and things like that. But at least for the first few days, it's not necessary to do anything except for just keep your skin very well lubricated. More for comfort than anything else, actually.
So how are you feeling?
I feel good. I feel like I was in the sun a little bit long and my skin is tight. It's still a little bit numb, so my lips are having trouble moving. I don't know if I'm smiling right now.
You're actually drooling, but I won't tell you that. No, I'm kidding.
But I feel good. I feel really good.
Turn the clock back 10, 15 years, so you can't expect to go from 75 to looking like a teenager.
Right.
But if you just want to make yourself look younger, get rid of some of the wrinkles, get rid of some of the sunspots, and just generally just give a brighter, a fresher, pinker tone to your skin, this will do all those things. That's as bad as it's going to get all day today, and
There's nothing.
there's nothing.
You're good.
Thank you. I take a lot of pride in making it pain-free. Unadulterated blood right there. This is this typical
Look
of
at how
blood drawers you're
beautiful
going to
that
see.
blood is.
And get ready to see a big change, ladies and gentlemen.
So another quick question. PRP facial and vampire facial, is that the same thing? Is that...
Yes, they are synonymous. I mean, you can call this lots of variety of things. A plasma facial, a platelet facial, a PRP facial. Yes, I do the vampire facial. What I'm doing on you is actually the vampire facial. Whatever we want to call it today, a plasma facial, PRP facial, but I am actually licensed to do the vampire facial.
Maybe you'll make me a nice meatball.
That's
No,
okay.
you have to see her meatball.
Okay, so what you're gonna do, there's just some very fine little wrinkles in your chest area here. So what we do is we're gonna apply the PRP right there. Then I'm gonna just move them around just in that area where we see some of these little fine wrinkles. And this is as common as it's gonna get. I mean, this is something when you're out in the sun, and now you can just feel a little gentle tickling in your chest. And we may not put as much anesthetic here as the rest of your face. You may be feeling this a little bit more, but for the most part, just feels like a little tickly sensation. I mean, nothing too dramatic here.
You feel okay?
How do you feel?
yeah.
Outstanding. One more time, because now we have the little pores open here. So I'm doing is I'm going to put them right here again. We're going to absolutely get rid of these little wrinkles here. And now we're going to go horizontally. So we already went vertically. And as everybody here can attest, we're getting a beautiful little response here that's showing just a little bit of redness, just a little bit of a sunburn basically. And let's get
Let's talk about the view.
I'll leave all the commentary to my associates over here, okay? I'm getting work done over here. Now what I'm going to do is I'm going to go horizontally, right across this little line right here, and we're getting that same beautiful, it looks like you were in a tanning bed, basically.
Yeah.
Right?
Perfect result there.
Cool.
You're gonna freak out. Oh my goodness, are you going to freak out when we're done with this? I mean, pore size and scarring from pimples that you had when you were younger, that, like I said, if you want to give me a 1 and 2.
Scarring might take a few treatments.
Yes, yeah, absolutely. But I think you're going to see an improvement on the first. what I'm literally doing now is these little needles are going in and they're actually breaking up scar tissue that are inside. I can actually feel the texture of your skin. I can actually feel loosening of the scars that you had in here from scarring when you were younger. I can absolutely feel the difference in your skin. Your skin has much more plasticity to it now that we broke up some of those scars. Now if you come down to the cheek here, I'm thrilled for you. Because now that I'm getting a much closer look, when I first looked at you, I would never notice. I guess that some people are more self-conscious when they know that they had something. I wouldn't really have noticed this right off the bat. But now that I'm getting a very, very close look, yes, there's some very fine indentations here. You know, some very small from acne, but this is where it works miracles. It really does work miracles on scarring. And I'm getting nice and deep into these scars. And as I'm feeling them, I actually feel a different texture to those, that mild little scarring you have there. A little bit more, please.
You're so polite to each other. How do you do it?
Because I can do this now.
Yeah, I think it's right. You know, it's all an act she's doing here. As soon as we get behind closed doors.
I growl.
Yes.
Yeah. When you see my teeth, you know you're in trouble.
Yes,
Right.
our four kids all have their individual imitations of when she loses her marbles and her patience
The
with
stomp.
myself, with
Growl,
them.
yeah.
But everybody's afraid of her in the house. Nobody's afraid of me. I'm like, I yes everything. I overdo everything. I yes everything. She's puts her foot down. As sweet as she appears, she ain't. Look how beautiful. And I'm going a little deeper than I did. You see a little bit more blood here, just because I want to get into all these scars here. This is looking so, so beautiful. So turn toward me, and let's start getting some of the skin in here. Like I said, usually the night that you get this done, you can go out for dinner, you can start doing your thing. I'm a little more, like I said, a little more aggressive with you, because I want to kind of break up some of these, mild little scarring, what's called fibrosis, a little bit of, hardening inside those little scars right there. So, like I said, you still can go outside. Yours might be a little bit more pronounced in terms of the sunburn that you're going to see, but I still think you're going to look great. And if you want to do your thing tonight, you can go
I'm not
about
doing
your
anything,
activity.